Good afternoon, and thank you for joining our chat today, titled You're Not Alone, Mama, Finding Your Village in Uncertain Times. My name is Alexandra Pena, Perinatal Mental Health Coordinator at the Partnership for Maternal and Child Health of Northern New Jersey, specifically the Perinatal Mood Disorders Program or Postpartum Depression Program. Before we begin, I do want to mention that this chat will be recorded. The Partnership for Maternal and Child Health of Northern New Jersey is a nonprofit organization committed to improving the health of women, children, and families. We have a variety of programs, 2 family success centers, and home visitation programs that help mothers and their families. If you are interested in learning more about our programs, please check out our website, www.partnershipmch.org. The Partnership's Perinatal Mood Disorders Program or Postpartum Depression Program is sponsored through a New Jersey Department of Health grant. The program provides services to 8 New Jersey counties: Bergen, Essex, Hudson, Morris, Union, Passaic, Warren, and Sussex County. We provide education, such as presentations to family and providers on topics such as emotional well-being, as well as resources for mothers and their families. We also provide support groups. At this time, we have virtual support groups to support pregnant and new mothers and their families. We also have our emotional health phone support program, which is a free service we provide via phone and connect mothers to mental health services, additional groups, or resources. This is available to pregnant women, mothers with babies up to 1 year of age, and mothers who have experienced a loss. We also facilitate community programs. In today's chat, we will have a wonderful discussion with Dr. Lopez on mom and baby's well-being, communicating with your child's pediatrician, and the importance of staying connected. It is essential for mothers to stay informed and familiarize themselves with resources that are available, as well as maintain open communication with their providers and loved ones. At the end of the chat, you will be given the opportunity to ask questions. Please use the chat box to type in these questions, and then I will inform Dr. Lopez of these questions. Today, we have the pleasure of having Dr. Davina Lopez with us. Dr. Davina Lopez is a board-certified general pediatrician serving the New York and New Jersey area. She has been practicing pediatrics for over 10 years. What she finds most fulfilling is developing a great relationship with the families she serves. Dr. Lopez is also a mother. She shares that this experience only enhances the work that she does. She is a medical influencer on social media where she creates content, videos, and goes live to engage with her followers. She has a website, drdavinalopez.com, and a podcast called Dancing into Parenthood, where she gets to inspire and empower parents. She shares, together we will choreograph a beautiful dance to help you learn the moves to connect to yourself in this new role you are playing in your life, your baby, and your partner. Welcome, Dr. Lopez.
Thank you, Alexandra. Thank you so much for introducing me. And I want to say thank you to the Partnership of Maternal and Child Health for asking me to do this. I'm so excited.
We are as well. So, Dr. Lopez, we often hear it takes a village. In our very support groups here at the Partnership, we discuss the importance of establishing and utilizing your support system and how important that is. Could you discuss the importance of having a support system as a new mother? And when thinking of your support system, who are the people that should be a part of your support system?
Right. So having a support system for a mother is a necessity, right? It's a total essential. I know we're throwing the word essential so much around these days, but it really is an essential component to motherhood, right? Because we shouldn't feel isolated. We shouldn't be doing this alone. Motherhood, is something like a sisterhood. And it's really great when you get to share it with other people, because doing it all by yourself is really exhausting and really difficult. And when you feel that isolation or you feel like you don't have the support, then that leads to higher rates of baby blues and postpartum depression. And so mothers need to feel supported. And you have to look for who is your village, right? Who are these people that are in your village? You should incorporate your partner if you have one. They can be a great resource because they should be your teammate, right? They should be the person that you can almost like tag team. I need a break. Can you take care of the baby? Or, you know, schedule time alone with that person, or even alone by yourself to take care of yourself and for some self-care, right? Not everybody has a partner though. So who are the other people that you can incorporate into your village? Are your family and friends, right? Sometimes we have family and friends which can be judgmental, and I would say those are the people that maybe you want to stay away from, and you want to have those people that are really supportive, that are your cheerleaders, maybe that have experience and can like help you along the process, but not people that you feel are judgmental or going to criticize you, because that can really make you feel worse throughout the whole process, right? So you want people that are positive, have a good mindset, and can be a great support for you. Right now, I know it's hard because maybe they can't physically come into your home, but maybe you can do things like this where you're virtually speaking with them and having a break with them, having some coffee or tea with them, and, you know, sharing what's great about being a mom, what are your gripes about it, where your frustrations may be coming in, right? And then these are people that maybe you can even have like a walk with, maybe schedule some like social distancing at the park and take the baby out in the stroller, get some, you know, good sunlight and everything. Since the weather is getting better right now, this is like something that we should take advantage of. But I know, you know, like, for example, the resource of the Partnership for Maternal Child Health also has plenty of resources which are great for mothers and parents. And I think, you know, that all should be part of your village. But a lot of people forget that the doctor can be part of the village as well, right? So when I say that, people always look at me like, oh, I didn't even consider that. And I'm like, yeah, because one, we do have a lot of resources and educational materials for you, and we usually have a wealth of information. I know that sometimes people feel frustrated with the doctor because they feel like they don't have enough time with the doctor, but I'm going to help you to figure that piece out. But the doctor really can be an amazing resource. Even your OBGYN, we can even be a resource for getting stuff like formula, because the drug reps come and bring us samples. And so right now, I know that's even been a challenging piece to figure out where to get stuff for the baby. But, you know, that's part of having your support group and building your little village to help you raise your child.
Thank you, Dr. Lopez. And I heard you mention a pediatrician, and it's true. Oftentimes we don't think of a medical profession. It's not even a medical professional even mentioned in a mother's support system. Can you discuss why, you know, establishing a medical home is such an important resource in a mother's village?
Yes. Establishing a medical home is so important. People have, I don't even think, let me first describe what is a real medical home, because people, I think this is like a new term and people are not sure what that really means. A medical home is basically having a practitioner that you see regularly, okay? So whether that is your pediatrician, your family practitioner, your internist, in any way, it's your primary care doctor, right, that for yourself or for your baby that you see regularly. When you establish a medical home, number one, you need to do some research, right? You want to ask, who are practitioners that are trusted by your friends and family maybe, or, you know, we can use social media. People usually have some good information of practitioners that they really enjoy visiting, because they are the people that go the extra mile. They are the people that will show you that they really care. And what you do is, I guess the first step is the easiest thing to know is who is located close by to you, right? Because you want someone who's close to home, especially when you have a young baby, because you're going often to see the doctor, right? You're going for their well visits, and sometimes when the baby is first born, we have to do checkups really like frequently, especially if you're breastfeeding, to make sure baby's gaining weight correctly. So you want to make sure that the location is good for you. You want to make sure that they're covered by the medical insurance, right? And then, like I said, get some good resources. If you have family and friends, if you have a mommy group, somewhere where you can ask some questions about who are practitioners that they've seen that they really enjoy going to or feel like they can trust and they enjoy the visit with that doctor. So establishing a medical home is really important because then you get to develop a good relationship with that person, right? So once you start like having regular visits with one of your practitioners, then you can develop a really good rapport with them. They understand you, you kind of know how they work. Everybody has a different personality, right? So you have to also know what kind of personality do you enjoy and, you know, what are the qualities that you enjoy in having a doctor. You know, for me, I'm a person who's very, I don't know, I want to say I'm always laughing. I'm very positive. You know, I'm the doctor that's going to give you a hug when you come in. And, you know, I enjoy that part. There are doctors that are more professional, maybe in a way where they're, you know, they keep their distance, but are very good at their knowledge. So you have to know like what kind of personality really drives with you. And you want to know who's available, right? When are the office, what are the office hours? When are they available for you even after hours? Do they go to the hospital that you're a part of? Because many times if you're, you know, nobody wants to be in the hospital, but if you did have to be admitted to the hospital or something, your doctor can come and visit you. They can take over the care. They can still manage you as a patient when you have a medical home, right? And the other piece that sometimes parents don't know too much about this because this is all kind of new is, you know, we are on call, right? So you want to get to know your doctor. So when you speak to them at like 2 o'clock in the morning, you know, for me, actually, it makes it a lot more pleasant when I know who I'm speaking to. It's a whole different sort of conversation when I'm like, remember that we spoke about this, or, you know, I need you to look at that. And so it just makes the relationship so much nicer. And you trust that person in a different way when you know them, right? As a mother, you always want to make sure that you have that sort of trust in your pediatrician. That's so important because you want to know that the information that they're giving you is reliable. You want to know that you can count on them. You want to make sure that they're going to support you and be there for you. So establishing a medical home for me is one of the most important things. I don't want people hopping from doctor to doctor. You're not going to get the same sort of medical care. When you have a medical home, it's really just like being at home. They're like family. It's a different sort of relationship.
Thank you, Dr. Lopez. So really finding a pediatrician that you can make a connection with, it sounds like, and just build that relationship with. But a question that I want to know, and probably other mothers want to know, how do you establish a good rapport with a good rapport with your pediatrician? How do you build on that relationship?
Right. So usually, like most offices these days have a few different practitioners, and I know sometimes it's difficult to have your visits with the same person for every visit. But I think when you do call the office or when you're scheduling your visits for your baby, you should, number one, let the receptionist know who it is that is your preferred doctor to see, or your preferred pediatrician, whoever the practitioner is in the office that you really like. Request for that doctor to do the regular visits. So I'm talking about like the checkups. And that way you get to have a longer visit with that doctor, and you develop that relationship with them because you are going to see them more often. One thing that you may not have control over is like when you have, for example, a sick visit or a visit that was unplanned, then you may have to see whoever is available that day. But the way to get that practitioner is to, number one, schedule your visits in advance, okay? If they know the doctor's schedule, then they can usually do it a few months in advance if you need to do that. When you call to schedule your appointments, you can always request to have some extra time devoted for your visit, because you may have some extra questions that need to be answered. You let them know that you have some concerns that are going to take longer than the usual visit, because doctors are usually allowed a certain time frame to see a patient. So you let them know, is there a more convenient time of the day for me to come in so that I can have more time with the doctor? Usually the way we maneuver the schedules is maybe at the end of the day, there may be some more time, or maybe the very first visit of the day. So you should be flexible so that you can have that extra time with your pediatrician. But it's important for you to really have a good conversation with the receptionist, and not that they just put you in any block. Like, you have to let them know, I need to see so-and-so for this amount of time because I have these concerns, or that I have all these questions. For me personally, if a patient comes into the office and let's say I didn't know that they needed a longer visit, I will ask them, can you come back maybe tomorrow or another day, during the week, where I can devote some more time to you, because that's important. I don't want someone to leave the office feeling like I didn't get what I needed out of this visit. You can also always request for handouts, because we usually have plenty of anticipatory guidance handouts. Like, usually when you come in for the baby, they give you like a whole checklist, but there's also a really nice handout that goes along with it from the American Academy of Pediatrics that we usually give to the parents. That way they can always reference it. So those are also good references to keep at home, that you should almost like keep them in a folder or by the refrigerator, because there's important phone numbers usually there, and a lot of guidance for yourself as a parent to even know like feeding schedules, things like developmental milestones. All of that is mentioned in there as well. So request those things from your doctor, because we have access to all of those resources.
And thank you, Dr. Lopez, again. So truly, communicating not only with the pediatrician, but also with the office staff, right?
Just the staff is important. Yes. Even your medical assistant, like, you want to have a good relationship with everyone. It should be a welcoming kind of like, from the minute you walk in through the door, like, you should be able to have a good relationship with the person at the front desk, the person who takes you into the triage after that. It's important to know who those people are, because these are the people that are going to help you, right? Though when you call the office, you're not calling me, you're calling my receptionist in the front. So when you have a good relationship with those people, and just like I said, when people know who you are, because it's like, okay, Alexandra came in today, and I know that she's concerned about her baby. Let me make sure she sees Dr. Lopez. Let me make sure she gets all her questions answered so we can give her this extra time. There's definitely flexibility. Like, I don't want people to feel like everything is so rigid in medicine. It isn't, because it's very unpredictable, right? Sometimes it is a quick visit where it's just like, okay, no, nothing really going on here that I need to address. Let's just talk about the usual things. But sometimes we do need that extra time to address whatever concerns, because if you go home with all these anxieties, that's not going to be good, right? I always say, like, a mom who is anxious is going to have a really fussy baby, right? Because babies feed off of your anxiety. They need to feel like they're safe. They need to feel supported themselves. And when you have a frantic mom or an anxious mom, a really nervous mom, the baby feeds off of that, and then they're going to give mom more problems. So for me, the goal is always like, I want to make sure that you have the education that you need, that you feel inspired, that you feel like you're educated, that you can handle this, that you feel confident as a mother. Because when you have that confidence, and that's not going to be an everyday thing, but when you feel confident about what you're doing, it's going to reflect on, on the way your baby is feeling too. So it's always important that you feel like I have my village to support me. I have they got my back, you know, like I know that if I'm not feeling great today, I can fall back on this person, and that person is gonna be like, no problem, let me help you out with even small things. Like I little tiny things that you may think are not even such a big deal. Like for me, things that are really normal with a baby, googly eyes and stuff like that. You know, parents get nervous about that and they're not sure. And then they can easily panic about something so small like that. And that's like a no-brainer. I could tell you in a minute, you know, like, don't worry about that. That's normal. And it's like, oh, the anxiety, the breath they could take, they can just like feel comfortable again. But, you know, that's the reason why. It's like, don't feel like any question that you have is like a stupid question or any. No, it's not. If it's going to make you feel better once you have the answer, please ask it. I rather that you do that than go on the internet and you're gonna see something that you wish you never read, or if you ask a friend or family member who is gonna like scare you to death, and then you're like wondering at home, oh my goodness, you know, do I have to be worried about this? Who do I ask? Reach out to your doctor. We can reassure you if it's just like something normal, and if it's something that we feel like needs to be addressed, we can say, hey, can you come into the office today so that I can just check? Other things that I ask parents to do sometimes is if you're concerned about something that you're not sure of, that you think is something strange that the baby is doing, get it on a little video, and you know, that way, because usually you come into the office and the baby doesn't do it. You know, get it on a little video, at least then I could see it. And you know, that always makes parents feel better, because they're like, okay, I know she really saw what I saw, because babies act like angels when they come into the office, and then it's like, oh well, you know, perfectly good baby here. But those are all the things that you can do to help you communicate better with your doctor, and you know, ways to finagle the office visit so you can get a little extra time with your doctor.
You know, thank you for sharing that. I really like the video tip, which I wish I would have known that back then with my children.
Yeah.
You know, but it's quick. It's a quick and easy way to keep that communication, and just emphasizing just communicating with the office as a whole, because you have to get through the receptionist, right, to get through the provider. So so just communicating with your whole medical home, such as, you know, your pediatrician's office as a whole, as well as your pediatrician, because they'll be able to, if the pediatrician is out that day, they'll be able to communicate back to the pediatrician.
Yeah, we're a team. It's a whole team effort. So you know, you have to know who are all your teammates here. Yeah.
So the question that a lot of moms are, you know, wondering during these uncertain times, and what are, you know, and concerning their baby's well-being and safety, what are pediatricians doing to keep babies and families safe during these times?
So luckily, you know, this is just a great time with the whole virtual aspect of everything. You know, for me, I use social media. I love having a podcast, because those are plenty of free resources that I can give to people with plenty of education. But right now, we are so lucky we have telemedicine, which is great because you don't have to leave your house. We can have a real visit where we're talking face to face like this. And, you know, you can tell me what your concerns are. It's basically like having a regular office visit. You know, it needs to be scheduled. We'll have our specific time frame. This is a great way to get your questions answered right now. And I love that babies can stay home where they're safe, right? We are very fortunate to have this sort of technology right now. The one thing that, of course, you know, you need to do also is have like a good exam. So sometimes you do need to bring the baby into the office, right? Because we have to check the weight and stuff like that. If you have to come into the office, the things that I do recommend asking before you go to the office is, will there be like a separate waiting room, or what is the procedure for that? Are you sitting in the car until you get called in? Are they putting you directly into the room? You know, pediatricians are usually in an office of a few rooms, so maybe, you know, you would have to wait outside until you can come in. And then everybody's taking the precautions for sanitizing the rooms, for making each step actually safe, because even something like the scale needs to be sanitized. You know, everything is step by step, so things are taking a little bit longer because we have to make sure that everything is sanitized before we bring in the next patient, that people are wearing the protective equipment that they need as well, like the face masks. So I think it's important, if you do need to come into the office, that you ask, what do you need to have with you? How is the visit going to be given, like what time frame? Where will you be waiting? Are there separate waiting rooms if you do need to wait at the office? Like, will there be one for sick kids? Will there be one for well kids? And the other thing is whether or not you'll be able to see your doctor. Is that person available right now? Because right now, with the healthcare professionals, sometimes we are doing different work. So some people are just dedicating themselves to like the telehealth. Some people are still physically at the office. I think that's also case by case, because, you know, some of us are working from home right now because we have children at home. So, you know, your provider may not be able to see you, but then who is the person that you will be seeing? So make sure that you call in advance to know those things. I think that's important. You want to know the availability, like even for the after hours. Should you be calling your provider or going to like an urgent care? Because we really want to keep people out of like emergency rooms. We really don't want people going to urgent care right now. Like, we really want to try our best to keep you at home where you're safe. If it's something like a sick visit, call immediately. Don't wait, you know, especially if it's something like a fever that needs to be done immediately. You don't wait at home for those things. I don't care if it's 2 o'clock in the morning, you call your doctor, okay? Because we are available. Like, pediatricians are one of the doctors that do call back immediately. I know sometimes I've heard like stories from people where they're like, oh, well, I called the on-call line and no doctor got back to me. Pediatricians are not those doctors. Like, we are the ones that give you a call back. So make sure that you use us, because we don't want you at home with a sick baby, especially right now, right? So basically, like I was saying, like, we have plenty of resources to help you out. A lot of the offices have great websites where there's information on things, even like medicine doses and stuff like that. So usually through the website, you can also get some good information on how we're handling things right now, because things have changed a little bit. But, you know, for the most part, I think we've been handling this whole COVID in a really great way, because luckily kids are not getting sick, you know, not like adults. So it hasn't been as, you know, like as scary for us on our end. It's been pretty good, because thank God, like, kids are pretty healthy and they do really well. And so for us, it's been a path of like, yes, we've had to make some changes. Yes, we've had to make some adjustments, but we're still available, and we're just handling things in a little bit of a different way. Like I said, you know, doing the telemedicine and having availability at home, which is nice. But, you know, if you do have to come in, it's not something where I want you to feel like, oh my goodness, what's going to happen if I go to the office? Am I going to get exposed or whatever? Because we are taking the precautions as well.
Thank you, Dr. Lopez, you know, for kind of a relief for maybe a lot of the mothers on here hearing that, because there has been a lot of questions, you know, and you know, again, communicating with your provider's office, knowing, you know, what's the procedure if I come in? What if I don't want to come in? Can I do a telemedicine visit? Or what are the after hours? So finding out if they do, most like you said, they do have after hours. So if you're not familiar with that number, or you're not aware of it, just really communicating and finding out that important information.
Yeah, that number should be on your refrigerator. Like, just keep it up there, because that's something that you're going to use. And when your child is sick, that's the last thing you want to have to look for. So put it somewhere, like either store it in your phone or put it up on the refrigerator, somewhere where you can see it easily and you can reference it when it's needed.
Absolutely. And I think it, like you said, that refrigerator will come in handy. So it will come in
Yeah.
handy if you're checking out the refrigerator. I
Yeah,
know that
to have
I
poison
definitely
control
check the
there
numbers.
and your doctor's number there. Like those
Yes,
things have
yes,
to be there.
yes.
Yeah.
The poison control, absolutely. So we do have, I think we're gonna get in some questions now, if that's
Hmm.
okay with you. And
Yes.
let me see, okay? Give me 1 second. Okay, so we have, what suggestions do you have for moms who are stuck at home because of COVID? Do you have any tips on how to not feel so isolated?
So what I would suggest for you is to use whatever digital devices you can use, right? So you want to stay connected to your family and friends. If you can use things like WhatsApp, because then you can have like the whole video talk. If you can use social media right now, go to my Instagram page. I always have lots of good information there. It's Dr. Davina Lopez. I post on a daily basis. I've been putting plenty of information about COVID-19 and how to take care of your child at home. Um, but basically, you should be using good resources. So if you are having some questions about what's going on like right now, then you use good resources like the American Academy of Pediatrics or Healthy Children. You can also use, of course, the CDC website. There's lots of good information there. But when you don't want to feel isolated, it's so important for you to connect to your friends. You have to connect to people that you love, that you trust, that they can be there with you and give you good guidance. And sometimes it's not even about that. Sometimes it's just like I'm at home and I'm tired of being at home and I just want to like feel like I'm hanging out with my friends and stuff like that. So, there have been so many wonderful groups, like a lot of for me, I've been doing a lot of like Instagram live, because it's just good to even have that time with groups of people, like sometimes not even a one-on-one. You can just like get in and talk to a few different people. There's a lot of nice mommy groups out there. You have to figure out which one you fit into, because you want to make sure that you relate to everybody, but use those resources because right now there's so many amazing things. Like you can do Zooms with your friends. I did one the other night with a group of like single moms because we all have our own gripes, right? Even like things like co-parenting and stuff like that. So it's always nice to have some sort of you need to have that social aspect of your life still. Feeling like you're at home and isolated it can become very uncomfortable, and especially when you're home with a baby constantly, you feel like you don't have that adult time. You need to find who are your people, right? And that's what this whole talk is about. Who is your village? Who are the people that you can count on? Who are the people that sometimes at 2 or 3 in the morning, you're like, I'm done today. I need help because I've been up all night and I'm feeling so exhausted. Sometimes you just need to like get that off your chest and talk to somebody. The other thing that I love to do is get a journal. Writing down how you're feeling is so important. It's amazing how good you feel once you get like your thoughts, your feelings out on paper. It's like it's almost like a cleansing in a way because you get to release, and it's your private time. It's your thoughts that sometimes you feel like I can't share this with somebody else. It's private, but you can put it down in that journal or on a piece of paper, and you can say, you know what, I released it and it's here. And sometimes you just have to say, I give this to a higher being and help me take care of this, because that's important for you too. So even like if you're religious, a church group or something like that may be a good resource for support as well. If you're not religious, do you like spiritual things like If you can meditate, that's also an amazing experience for most people. I know it may be hard to do, especially when you have a baby. Don't have too many expectations, you know, a minute, 2 minutes, a little nice music, a cup of tea or some coffee, whatever is comforting to you. You know, maybe those are the things that you can help to not feel so isolated, right? You need to be able to give back to yourself.
Absolutely. I completely agree with you. I always share with the moms, you know, do something that feeds your soul, whatever that may be. And
Yeah.
that includes in, you know, in the self-care aspect of it, and also maintaining that social connection, especially during these times. So the good part about, you know, having smartphones is we're able to do video like you mentioned, or, you know, there's a lot of great like Instagram lives or virtual mom support groups that we offer here at the partnership. Really just find maintaining that connection.
Oh my goodness, it's so important. It's really important for you to know what makes you feel good. You know, for me, it's about dancing and putting on some music. That changes the whole mood of the house, you know. And babies love music. They calm down, they feel better. And it's important for you to know what makes you feel good, because you need to take care of somebody else. You have to fill your cup. Always put yourself first. Like, you have to do what you have to do in order to take care of another human being. You know, moms always feel guilty about that, and I'm like, absolutely not. You should never ever feel guilty for taking care of yourself. There's just no way that you can take care of someone else if you don't take care of yourself, and you don't love yourself, and you don't feel good about yourself. And it's really hard. Those first few weeks are very emotional. Those first few weeks, you're drained. You're so sleep deprived. You just don't feel like yourself. So it's okay to say to yourself, like, you know what? I deserve this 30 minutes. Let me take a nice warm bath. You know, like, I deserve to do a little meditation. I deserve to put on a candle because it smells really good. It's okay to do those little things. Like, those little things just change the way you feel, and you give back in such a better way when you do that.
Absolutely. Thank you, Dr. Lopez. Let's see, I have another question. Okay, this is a great one. How can I get my partner more involved with taking care of our new baby? He gets annoyed because I try to teach him how to do things.
Okay. So my first piece of advice is stop teaching him because everybody has their way of doing something, right? It's not going to be your way. And I can tell you this from my own experience. I know how frustrated it feels when you see someone else doing something with your baby and you're like, no, not like that. But if you want someone else to be involved, like your partner, allow that person to do things their way. And you have to accept that it's not going to be your way. It's okay for them to have their own style with the baby. And I think, you know, encourage it. If it's too hard for you to see it, then look the other way. You can, you know, there's plenty of like great videos and stuff like that where they can actually see like how to diaper a baby, or, you know, how to even like give the baby a bath and how to feed a baby. There's plenty of great things like on YouTube. Wonderful videos that are quick and easy. So maybe they don't get frustrated by you telling them like, oh, do it like this. But that's a good way to let them get involved. Like, don't push too much. Let them do what they feel comfortable doing, and then little by little, they'll feel more comfortable doing other things, right? Because this is a whole learning curve. It's a learning curve for you. It's a learning curve for the partner. So you have to allow a person to like do things at their time, right? Like, allow them to feel comfortable doing what they're doing with the baby, but also let them develop their own style. Don't be naggy about it. Just allow them to have their way with the baby and learn how to love the baby in their way, because we all love in a different way. You know, so it's not going to be your way. So let go of that piece, right? Let them do what they want to do, and let them know that you're okay with that. Because I feel like when people feel like, okay, she's embracing the way I'm doing it, then they feel more comfortable and they'll go ahead and initiate other things. But if you're like constantly trying and forcing, that's not going to work out. So you have to kind of just let a person do their thing. Let them know that you appreciate them when they do that, because it gives you some time to step away and have your own time for yourself, or to catch a nap or something like that. So let them know how grateful you are for that, and how important it is for the baby to have both people around them, surrounding them with love, and doing all the things that we need to do in order to take care of the baby. But allow them to attach in their way to the baby.
Sure, thank you. Absolutely. So letting dad have built his own relationship with baby.
Very important, because I see more and more that dads do want to be a part of the baby's life, and take care of them, and they're getting more hands-on. It's not the same way that we do it, because we are naturally nurturing people, right? Women are nurturers. So, it's new to the whole like dad game, but they're getting there. I see more and more that they want to be more hands-on. It's just they feel uncomfortable, and it's okay. Like, let them know you feel uncomfortable too. I'm just learning this myself. So it's okay that they don't do everything perfect. Nobody does anything perfectly, right? So sometimes we have to let go of that piece of like the perfection out the window. We're doing things as best as we can, and you can even have discussions about that. Like, I always encourage people to have like a think of your family as an empire, right? You both are creating this empire. What kind of parenting styles do you want to have? What did you love about your parents raising you? What were the things that you didn't like that your parents did? And then figure out like which way you want to raise your baby, and what you can do to make your baby's life amazing. Because I truly believe in the whole like trickle effect, right? Whatever good things you bring to your baby, that baby's gonna grow up and become an amazing adult. So be together. Good communication with one another is so important, so you figure out what you need to do for your baby.
Absolutely. Here we have another one. So this one is talking about mother's emotional well-being. So do pediatricians ask moms about postpartum depression? What advice would you give a mom who's really struggling with symptoms of depression and anxiety?
Okay, so yes, we do address postpartum depression at our well visits. That's part of the questionnaire usually. Honestly, I feel like, that one kind of gets brushed off, because moms a lot of times even feel guilty talking about themselves when they're with the doctor face to face. They just want to talk about the baby. Those moms that I could see that they just want to talk about the baby, I could already tell that they're feeling anxiety, right? And that's really normal to feel that way when you first have a baby. It's normal to feel the nervous feeling, the blues. It's also part of the whole hormones that are changing in the body. And just the fact that you're trying to figure it out, and maybe you have these expectations of what it was going to be like, and you're not living up to it. And if you're looking, too much on Instagram and everything looks perfect for everybody else, you may really feel like, what am I doing? I'm not doing this correctly. Like, what on earth am I doing? And anybody could feel that way, right? What we usually do, like I said, we do a questionnaire. I usually just ask the moms outright, because I want to know from them. I want to see their facial expression. I just don't want like a check mark on a paper. It's very easy to check, no, I don't feel any of those things. It's another thing when I look at you in your eyes and you say, yeah, it's been really tough, or you start to cry, or then I know, okay, now you're being more honest with me about these things. What we do, some offices have like support groups for moms. We also can give you, phone numbers for like mental health access. And right now, I mean, the great thing is, because mental health is such a hot topic right now, most insurance companies are also covering for mental health services. And another great thing is that there's plenty of telepsychiatry, like it's all done virtually these days too. So you can actually have access just virtually if you need it. And that way, if you need a support group, we can refer you to a support group. But there are some offices that actually have like mommy groups just for this sort of thing. So you can always ask your doctor if they have something like that at their office.
And just being informed of the resources. We also, at the partnership here, we also support moms and do that phone support services in which we connect them to those resources. So we're also a resource to the pediatrician's office, and being that way to help mom connect with those resources she may need, whether it be a mental health therapist or a virtual mom support group or what any other support service she may need.
Right. So never feel like you're alone. Never feel like that. Like you just have to know who are your people, who is available to access, and where do you feel most comfortable. You know, I think for me, I'm a pretty private person where I don't want to share everything with everybody. So, you know, it helps for me to be like in a smaller group versus a larger group. And everybody's different. Some people are very extroverted and they want to you know, talk to large groups. And it's good when you hear from other mothers, like they're having the same exact anxieties as you are, because then you're like, oh, I'm not the only one. Like when you shed some light on that, then you're like, okay, this is totally a normal thing for me to feel. And I know because all these other women are feeling it too. It's not just me. When you feel like, okay, we're all going through this together, then it normalizes in a way, and that piece of like feeling like an outsider is taken away. Like that shame almost is taken away, and you can just kind of relax. But believe me, there's no mother who has it 100% figured out. I've never met anybody like that. Even myself, coming from a background of pediatrics for so many years, when I had my son, it's like the doctor brain went out. I was just a mom, and then, or sometimes I used to think too much like a doctor, and then I'm thinking about all these things. So believe me, it even happens with us. It's not like we're not excluded from that. It's just what happens as a mom. Like there's just so many new things going on in your life, and you do want to do things as best as you can because it's the most important person in your life, right? It's like your little treasure, and you want to make sure that you do everything as best as you can for that person because you love them so much. But you know, be forgiving with yourself, because if you're not and you're too tough on yourself, you know, that's gonna be really unhealthy for you. You know, you have to be able to forgive yourself when, you know, something dumb happened. You know, there was a blowout of the diaper or something like that. Okay, so, you know, like have some humor about it too. That helps you so much. It happens to all of us, every one of us, you know, it's okay. It's totally okay.
Thank you, Dr. Lopez. I have another question here, and I know you spoke about, you know, what pediatricians are doing in their offices and the safety. So I have a question here. They asked, should I give my daughter her vaccines or should I wait until this is over? And this is a question that we've also gotten in our program when we have spoken with our mothers.
Yes, yes. So we're still vaccinating. We want your baby to have their vaccines because that helps to keep them healthy and gives them the protection that they need. And then when we can all be together, they, you know, they have the antibodies that they need to fight certain things off if they get exposed to it. So yes, those are the visits where you do need to come into the office, obviously, because we need to administer a vaccine. But we're not including vaccines right now. We are definitely still keeping up to date with the visits so that your child can be vaccinated. And like I said, you know, those are the visits where you are going to have to physically come into the office, and you can ask, you know, what are the precautions that they're doing. In that way, I think most offices are just handling it the way we always did. We always did things under a sterile technique. So that's part of our practice already. I don't want any parents to be afraid in that sense. But we are trying to keep everybody up to date with their vaccines. And I know that there was maybe like a period of time where people maybe missed that visit. You can go ahead and reschedule it now because doctors are basically like getting the office back on track.
So thank you. So just them figuring out, speaking with them and inquiring, also asking them what they're doing to relieve their anxiety, asking them what they're doing as far as when it comes to vaccines.
Oh, yes, yes. You should always keep your child up to date. possible. You know, there are some reasons when we can't do certain things, but for the most part, you have a healthy child who needs to be, you know, updated in any way. Let's say they missed their well visit and that was a visit where they were supposed to have the vaccine administered, then make sure that you reschedule it at this point.
Thank you, Dr. Lopez. I have another question here. Let's see. So I have some people had asked about just having people around the newborn baby. So someone asked, is it okay for my parents to come and see my newborn right now? They feel a little bit scared, but they really want them to see him. They really want to see him. The family members are a little scared, but, you know, to see them, but they're not sure if it's, you know, it's okay during this time.
Right. So just like we've been already discussing with the whole coronavirus, you know, obviously if they are people of a certain age, if they fit into that elderly category, you know, you have to ask whether there's something that they should be coming out and coming into your home. But it's the same precautions as usual of if somebody is going to come, how are we maintaining the social distancing? Are you doing something where like they can be at the park with you and you're just, you know, doing that sort of thing? Or if someone is really coming into your home, then you have to know where they may have been exposed and stuff like that. So this is a time where you have to be very cautious because obviously we need to go out for certain things like to the store, the supermarket and stuff like that. And so are they making sure that they're wearing their face masks? Are they making sure that they're keeping themselves healthy right now? So I think like case by case, it may be different, right? If it's someone that you already live with, that's a whole different situation because you're already in the same quarters. And then you just do the usual stuff of, you know, washing hands. And I would still ask to like wear a face mask right now just because of the situation that we're in. But having an outsider come into your home, that's really something where you have to ask many questions, right? Because if they're physically coming into your home, where have they been? Have they going to work? You know, so I think that's really something that you have to know very good answers to, because if there's someone who's going out for work, you know, and they're exposing themselves to other people, this is not the time to have people coming into your home. I wouldn't suggest that at all. And, you know, you can always blame the pediatrician for saying no. Because I know, like, you know, there's that guilt. You never want to tell your parents, like, no, they can't come into the baby. And especially, like, I know for Latinos, like, we are super close people. And, you know, it's like, absolutely not. You can't tell your mom not to come and see your baby. So, you know, those are the things, like, you have to remind them, this is this special uncertain time with coronavirus, and we want to make sure that we're not exposing the baby to anything right now. We want to also keep you healthy. You know, sometimes when you make something all about somebody else, then they're like, okay, I understand. So then you can do other things like FaceTime or WhatsApp or a virtual visit in some way, where you can actually present the baby to everybody. Because I know, like, even right now, people are missing out on their baby showers and stuff like that. So can you do like a Zoom where you can actually maybe have that in place for that reason? Because you wanna celebrate the baby, right? That's also part of the joy of motherhood. Like, this is your new baby that you want to be able to share with your whole family, with your friends and everybody. So you don't want to miss that social piece. But right now, having someone come into your home with a newborn who has no immune system, right? They're just developing their immune system. You have to be very, very careful who you actually allow to come into your home. And don't feel bad about that. Just let people know, like, this is the reason why. And as soon as it's safe, we'll all get together. But, you know, right now the baby's immune system is just developing, and I make sure that I keep my baby healthy. And as the mom, you are the advocate. So you can't feel bad when you have to say no to certain people, even if it's your parents. Like, I know that that's really tough, but your main priority is your baby.
Absolutely. So just keeping the safety and well-being of you and your baby in mind, and being able to communicate with your loved ones is really essential during this time. So that wraps up our questions. Thank you, Dr. Lopez, for joining us today. Like we shared in the essentialness of really building that village, and it truly does take a village, and remembering that you're never alone in this.
No, never, never. There are so many people, and don't just remember to keep us in the loop, right? Keep your pediatrician in the loop. We love being part of the family, and we can help provide some comfort to you when you're anxious or feeling alone. Believe me, we are there. So reach out to us and use us. It's something that I love it. I totally love speaking with my moms and comforting them and supporting them, because I know how important it is, and I know how important it is for the baby. Like for me, everything is about the babies and the kids, and I know that in order to have good kids, you need to have good care. So you have to take care of the parents. It's important.
Absolutely. Thank you all for joining us today. Make sure to check out the partnership's website at www.partnershipmch.org and view the virtual mom support groups available to our pregnant and new mothers. Also, please check out Dr. Lopez's Dancing into Parenthood podcast. She really has a lot of informative resource in there. Again, thank you so much, Dr. Lopez, for today. Thank you.
Thank you, Alexandra. Thank you so much for having me. It was so much fun.